My one disclosure is I'm awful grateful to be able to talk to this group and grateful to the FDRS and Dr. Herbst. So talking about vein problems, venous insufficiency or vein problems can significantly worsen or add to symptoms of lipedema. And when I'm talking about vein problems, I'm talking about, saphenous venous insufficiency, not just spider veins. Though spider veins and visible veins are more common in patients with lipedema, when I'm talking about the necessity to treat vein problems, I'm talking about significant venous insufficiency that can be seen on an ultrasound. And I'll get into that more a bit later. So I think it's very important to treat significant vein problems prior to surgical treatment for lipedema. Okay, talking about the venous system, in the leg, 90% of the blood goes through the deep system, and the superficial venous system only pumps about 10% of the blood back to the heart, but it's responsible for far more of the problems. So most of the problems that we treat for venous insufficiency in the leg are really superficial venous problems, and that means like the small and greater saphenous in their tributaries. So in the venous system, blood flows through one-way valves, and they are propelled by muscular contraction. These valves here are during contraction, they pump the blood up. In between contraction, they prevent the blood from falling or pooling back down in the leg. And now, when these valves fail, the blood flows backwards between contractions and leads to increased pressure in the venous system. So the venous system has a pronounced impact on the lymphatic system. So the lymph is down here in the tissues. This is tissues or capillaries inside the tissues of the legs or arms, and the lymph is generated by the pressures in this system. So before the amount of lymph is dependent on the arterial pressure slightly, and also much more the venous pressure, which doesn't have dampers, so it's transmitted more readily back into the capillary bed. The lymphatics then, as you know, clear waste and fluid from the tissues, and they also have the one-way valves, and so it's critical. It's not just critical is the exercise. They also are dependent on the exercise, so it's critical to clear lymph for the exercise, but also the exercise and also helps clear the venous system, which has a feedback to the generation of lymph. So when I'm talking about diagnosing venous reflux, one thing that I want to point out is that we're talking it's a venous Doppler ultrasound, but it's different from the ultrasound that they use in the hospital to check for a DVT. So many people have had a check for a DVT, and they lay you down and they perform the ultrasound while you're on a table. Whereas when you're checking for venous reflux or venous insufficiency, the ultrasound is done standing. Now, you can do some standing and laying down in part of a comprehensive venous exam, but to really assess whether there's reflux or significant superficial venous insufficiency, you really have to perform that standing. So this is just a picture here of someone standing, and you can see that's how it's best done. And this is what we look for. So what we're looking for here you can see the vein, and then there's a Doppler gate that's measuring the flow. Now, in normal, the flow stops after contraction, and there's no further flow. Whereas in venous reflux, they're the same contraction, but the flow continues. So, as I mentioned, this venous reflux leads to venous hypertension. And venous hypertension is really the underlying cause of a progression of vicious cycle of worsening vein problems. So the hypertension stimulates inflammatory markers and adhesion of white blood cells. These markers then the white cells release metalloproteins, which weaken the vein wall and vein valves, and that leads to valvular incompetence, which increases the venous pressure even further. There's also a cycle here where this increased venous pressure generates more lymphatic flow. And over time, this overwhelms the lymphatic system and leads to more leg swelling, which, when legs are swollen, that increases the pressure in the veins. And so it's a vicious cycle as well. So physiologically, these feedbacks can be very hard to combat. So a little more about what vein problems look like. So it could be simply spider veins or visible veins. They're actually called telangiectasias, and or it can be swelling in the legs, as we just went through. It also can be one of the common problems of vein problems is phlebitis, which are tender veins on the this is an example of tender veins on the skin, and that actually can be fairly serious and can be associated with more significant phlebitis inside the body. Varicose veins, that's what most people think of. But venous hypertension at the tissue level leads to a staining or a darkening of the skin, a hyperpigmentation, and that's the big word for that is lipodermatosclerosis. And it can also, finally, it can affect the health of the skin to the point that it doesn't heal properly and you get venous ulcers. So in lipedema, we see more patients with visible veins and easy and more problems with hyperpigmentation, especially around the shins, which are indications of increased pressure in the venous bed in the skin there. So the consequences of venous hypertension can lead to venous lymphedema, the swelling I showed you, or aggravated existing lymphedema or lipedema. It also leads to poor wound healing, and also leads to a leg inflammation, which can aggravate leg pain. In fact, many of the symptoms of venous insufficiency, leg heaviness, cramping, etc., are very similar to the symptoms that patients with lipedema have. It increases the risk of blood clots, as I showed you, the phlebitis, and all of these obviously aggravate the symptoms and treatment of lipedema. So, in conclusion, all efforts should be made to reduce the risk and optimize outcomes of lipedema therapy. Treatment of significant venous reflux it helps optimize lipedema therapy. And the first step is a comprehensive vein evaluation with a standing venous Doppler ultrasound. Thank you.